Welcome back to Mission Ready, the VA Disability Podcast. I'm your host, Dr. Marshall Barr, and I'm again joined by my co-host, Josh Ackler. Good to see you again.
Good to see you again.
Well,
Been a week.
It has been a whole week, right?
Yeah.
Today, as promised, we're talking about diabetes. What is it, and how can you increase your chances of getting service-connected and winning your VA claim? When you hear diabetes, what does that make you think? What's the first thing that jumps into Josh's head?
Oh, the diabetes guy.
Yeah, that guy at the commercial, right? The mustache. Yeah.
That's
So,
the
yeah,
first thing comes to my head.
That's the first thing. Yeah, but yeah, it's the beets, the shugs. So diabetes.
Diabetes. Insulin resistant. A1C levels are high.
Yeah, these are the diagnostic criteria they look for. When we think about diabetes, I think a lot of people think there's just two kinds, type 1, type 2. There's actually three. So type 1 is the one, most people get that's childhood related. That means your pancreas just does not make insulin and you need insulin all the time to survive. Type 2 is the more common one because that's typically insulin resistance, which means, you're exhausting your pancreas's ability to make insulin. So usually, as you gain weight, and your body's demanding more and more insulin, think of it as just like a muscle that gets worn out and then eventually just completely starts to fail and you need to start supplementing with insulin. And then one of the other ones that we've been seeing a lot more of lately is late onset diabetes, adult onset diabetes. And that is an autoimmune related diabetes. So that actually mimics type 1 diabetes. So whenever I hear a guy say, yeah, I've got type 1 diabetes, but I didn't get diagnosed till I was like 35 years old. That's typically the one we're dealing with, is the autoimmune kind.
Right.
You folks have no idea what honey and cinnamon can do for your brain. I'm 82 years old, and just a few months ago, I could barely remember my own grand.
So diabetes, you already mentioned it. As far as, diagnosing it and having it, is you have to have evidence of these lab values. And anyone that has diabetes is intimately familiar with these lab values. A1C, your hemoglobin A1C. Once it reaches over a certain threshold, you have diabetes by definition. Your fasting blood sugar level, a fasting glucose level, once it gets over a certain level, that by definition becomes diabetes level. All right. Mm-hmm. And another thing you had talked about is insulin versus insulin resistant in the beginning there. That's a big differentiator, right? So you can have diabetes that is, non-insulin diabetes. You don't need insulin. You're just taking oral agents like your metformins. You're taking the Ozempic shot. But then in severe diabetes, that's when individuals will start actually needing and requiring insulin to control their blood sugars. Right. So when we're diving into the world of diabetes, it's always going to be important to differentiate: are you on insulin or are you not on insulin? And that does make a difference when it comes to rating, which we'll get to later.
Right.
So, obviously, most important thing when it comes to a VA claim, you got to have those two things: the diagnosis and the nexus. So, before you even think about doing your diabetes claim, make sure you go get the diagnosis. You have to have a diagnosis, and this is not a clinical one. You actually have to have lab values that diagnose it.
Absolutely.
So the next thing is determining the nexus or the link to how it's either from your military or from another pre-existing condition. So just remind listeners the difference between diabetes being a primary service-connected condition versus diabetes being a secondary service-connected disability.
Okay, so this one's going to be kind of a straightforward. So there's primary, which is you were diagnosed in service for this. And then there's another one where you have a presumed condition from a toxic exposure.
And what is presumed or presumptive?
This is going to be where you get the chemicals. This will be your PFASs. This is like water, the contaminated waters, blue water Navy, brown water Navy, which means that you're out in the rivers in Vietnam, pretty much Vietnam era.
Yeah, so if you go onto va.gov and you look up presumptive conditions, Vietnam, diabetes is on there. So if you have any doubt, hop on va.gov and look up if your service time fit in that range and you are in those locations that they deem it.
Yes. And then there's a very, very good website that when I was a VSO, that I would use.
But what is it? You got to hang on his receipt.
It is Hill and Ponton, Blue Water Navy. Search it.
Okay.
that will give you longitude and latitude of where your ship was. Mm-hmm. You can use that as evidence.
The key here with presumptive, if you have a presumptive condition, you no longer need to prove nexus. You don't need a nexus letter. You don't need to show how your service caused it. Just by having a diagnosis of diabetes, you will automatically get service connected. So if someone is on the presumptive list, I say all you got to do is just get that diagnosis from your provider. It just has to say somewhere in your chart that you have diabetes.
Yes.
Then you will automatically get service connected.
And they'll call in sometimes. They'll call in to us and they'll say, "Hey, I want to service connect diabetes," and I'm like, "When did you serve?" They're like, "Oh, in Vietnam." Where? "Oh, yeah, Da Nang." And I'm like,
Yeah, so it's not. It can't just have served in the Vietnam era. You have to have been in the area.
Right.
So what are some of the other ways? We're talking primary.
so primary, would be actually getting diagnosed with diabetes in service.
So you have the record in service treatment records that you get diagnosed with it.
Another one would be, I said the waters, PFAS, would be the AFFF.
Yeah, AFFF. So just a reminder, AFFF exposure is not presumptive.
It's not presumptive.
So you will definitely need a nexus.
You will need a nexus.
So what is
kind of a little bit
AFFF?
of- yeah.
Because that's a kind of a nebulous term. What is that? What is that?
The firefighter foam.
The firefighter foam. Yes,
And you need a prolonged exposure.
it's that stuff that firefighters use to put out. It's been around since I think the '60s. It puts out tank fires, really literally any fire, boat fires, and you don't necessarily need to be a firefighter to be exposed to it.
No.
The chemical that's specifically in AFFF is the same chemical that is in Agent Orange. It's that PFAS.
Yes.
That's the chemical that's specifically that you get exposed to. And AFFF, you should, if you're trying to connect it to that, which we see a lot more happening, diabetes can be connected to it. Specifically through hormonal changes in metabolism, changes in blood sugar. And we have successfully connected people. The key is that you got to show your level of PFAS exposure or AFFF exposure. So either you got to be a firefighter or you have to have been served in a location where the groundwater is contaminated. There are so many military installations where that groundwater is contaminated with PFAS that it would take me the whole episode to list off all the installations. So if you have diabetes and you're wondering, could I have had exposure to it? I would encourage you, get on the internet, look up PFAS exposure military installations. And if your base falls on that and you were there for more than 30 days, you probably have a good opportunity of a claim to connect it to your primary service. And because what the issue is that PFAS is considered a forever chemical. It never goes away.
Right.
It goes into the groundwater and then it contaminates it. So if you are drinking water from the base, eating food that was cooked in water from the base, showering in the base, drinking water from the base, you have been exposed.
Right.
And the longer you're exposed to it, the more likely you are to have issues with that chemical causing issues in diabetes.
When you're looking it up, it's parts per milligauss of what the higher the number, the greater.
You folks have no idea what honey and cinnamon can do for your brain. I'm 82 years old, and just a few months ago, I could barely remember
Of the service connection.
And the military, this is not a presumptive. They've recognized that there's contamination of these bases, but they don't like to admit presumption because that means they have to admit they were wrong. And so, most of the time, I guarantee this is one of the cases. If you're trying to connect it to that PFAS or AFFF, you are most definitely going to need a nexus letter that is well written and is logically and rationally written out to describe how and why it has caused your diabetes. Those are some of the primaries, right? So now we get into the secondary. That is usually the most common way we see diabetes getting connected. What does that mean when someone hears secondary connection for diabetes?
Probably most likely going to be a twofer kind of thing. So let's say PTSD, weight gain.
So it's a current service-connected disability you
yes,
have that's causing or aggravating your diabetes?
Causing and aggravating. So PTSD, causing weight gain, causing your diabetes.
Because what's the number one risk factor for type 2 diabetes?
Overweight.
Being overweight and obesity, because that increases your chance of that wonderful thing we call insulin resistance.
Correct.
Any service-connected disability that can lead you to gain weight puts you at risk of being, eligible for the diabetes claim.
Then there's thing that we had a sidebar earlier, the PCOS.
So PCOS for, our non-female viewers is polycystic ovarian syndrome.
Yes.
So that is a disease women can have that can lead to weight gain. If you're diagnosed with that while you're in service, you are eligible to claim diabetes because that is a common cause of diabetes.
Then we have a little bit of our little uncommon ones, which would be, hypothyroid.
If you've got a thyroid condition that's service connected, not hyperthyroid, it has to be hypothyroidism.
Yes.
So if you've got low thyroid hormone and you need to take medication like Synthroid or something to augment your thyroid, then you have hypothyroidism. So that means if you had hyperthyroidism because of the military and then you had to have it removed and now you're on hormone replacement, thyroid replacement, you by definition now have hypothyroidism.
Right.
So just because you're service connected for maybe Graves' disease or hyperthyroidism, if they have removed your thyroid or killed it with ablation, radioiodine ablation,
Yes.
then the military or the doctors, the providers, they have made you hypothyroidism to save you, right?
Yes.
And so now you have hypothyroidism and you're at risk of all the downstream effects of being hypothyroid. One of the common things when you have hypothyroidism, it leads to weight gain. A lot of guys will say, yeah, I have the hardest time losing weight. I try, I diet, I exercise, but I can never lose weight. And, if they have hypothyroidism, it's not well controlled, then that is a really, really good way to argue that's why you have this obesity, and your obesity is why you have diabetes. Mm-hmm. Because the VA has recognized that obesity can be an intermediate step to another disability. And so if you can prove that through, medical rationale, then you can be connected. So yeah, we talked about the hypothyroidism. We talked about other things that can cause weight gain that are common are going to be your musculoskeletal things.
Yes.
So anything that's going to lead to chronic pain, immobility. So you've got back, neck, knee, ankle, hip problems, and you're already connected for those. And you've got a documented trend of weight gain, a documented trend of being on medication, continuing to have pain through failing medication or surgeries. What that does is it causes immobility. You can't move around because you're in pain all the time. Mm-hmm. So what do? You get sedentary. And what happens when you get sedentary?
Eat.
Yeah, you get that dad bod again, right? Start eating and you gain weight and you get insulin resistance.
Right. So the common denominator here is going to be a service connection causes weight gain. Weight gain is going to be the common denominator here. It's going to be obesity.
That is usually the common way to do it. Now, some of the other more uncommon, obscure ways that a lot of guys aren't thinking how they can connect their diabetes are going to be if you're on long-term steroid use. So this is like your prednisones.
Yeah.
So if you've got really bad COPD, you're service connected for, or really bad asthma to the point where you need to be on oral steroids all the time, or you're going to the hospital and getting steroids all the time. Well, steroids, they jack up your blood sugar. And so when your blood sugar is always in a state of being elevated, you're at risk of developing diabetes. Mm-hmm. So if anyone, even chronic pain, if you're on steroids all the time, because that's, a treatment for pain.
Right.
If you can document that you're getting steroids, autoimmune disease, Crohn's disease, ulcerative colitis, as long as you have it documented in your records that you're getting steroids, it can't just be one time. It's got to be a trend of getting it regularly. Then you have a really good claim of saying this has caused or aggravated my diabetes. And I think it'd be a disservice if we didn't talk about aggravation, right? So aggravation by the VA's definition is, if you were to have diabetes by itself, it would just normally progress. But if one of your already service-connected disabilities has caused your diabetes to get worse than it would otherwise normally have gotten, that is aggravation.
Correct.
Right? So give some examples of aggravation that we're going to see that or guys could potentially claim.
Okay, I'll give a scenario of it. We had a corpsman who was actually on a pump in service.
An insulin pump?
Yes, insulin pump in service.
So he had diabetes prior.
He had diabetes prior. Hypothyroid.
He got hypothyroid?
After, when he got out of service.
Oh.
Now he's got neuropathy. He has to wear diabetic socks. because his feet are just
Yeah, yeah.
horrible. So it progressed more than it would have.
Drinking warm water before bed improves eyesight almost overnight. Thousands of people are already doing this every night as they sleep.
Oh,
that's-
because the hypothyroidism caused him to gain
Exactly.
weight.
It aggravated because he gained more weight and he gained more weight, and he became sedentary because he also had issues with his back.
Takeaway is you can have diabetes even before you go into the military, and they can say, "Sorry, this is pre-existing." That's fine as long as you can show how the military or one of your current service-connected disabilities has aggravated it beyond its normal course and progression. You can get service-connected.
And some people might not even know they have diabetes.
All right, so now let's talk about rater scheduling. All right. Okay. So you've been service connected. A lot of guys are asking, what am I going to get for my rating? Can you describe what the current rating schedule is for diabetes and how they determine that?
Yes. So there's going to be your 10%, your 20%, 40%, and 60%, and 100%. So your 10% is going to be no medications, just managed by your diet.
Okay.
Then you got your 20%, which is managed with your diet and with some sort of medication.
So that could be insulin,
Insulin,
or oral
metformin,
medication.
or some sort of oral
injectable,
medication.
yeah, anything. Any medication.
Metformin's the common one, I guess. 40% is going to be requires insulin, restricted diet, and regulation of activities.
So that's the big one, is adding on that regulation activities.
Adding
Telling
on
you
to
what you can and cannot do when
Yes.
it comes to your diabetes with activities.
And then 60% is going to be your insulin, or medications, restricted diet, regulation of activities, and then episodes of ketoacidosis, DKA, and hypoglycemic reactions requiring hospitalizations. You act drunk, and you get pulled over, and they think you have a DUI.
You talk about DKA.
Yeah, with DKA,
yeah.
you got the fruity breath, and you act like you're.
Essentially, your blood sugar gets
it's
so
so
high that you start acting kind of like you're drunk.
And you smell
And your
like
breath has that kind of
Yeah.
acetone, alcohol
yeah.
smell.
You got like
Some people might think you're drunk. Yeah.
you got like that fruity wine kind of smell,
Bottom line is you need to be hospitalized, right?
and you need hospitalized.
If you're being hospitalized at least one time, or you're getting frequent diabetic care,
Right.
That's gonna be 60%, and then 100%. That's probably really bad, right?
Right. So 100% is pretty bad. This is going to be more than one daily injections of insulin. Somebody who's constantly getting care with the pump,
So if you're on a continuous pump,
continuous pump, and then your restricted diet, regulation of activities, frequent hospitalizations, and complications causing severe impairment.
So I mean, this is like you're getting hospitalized more than once a year, or you're getting an amputation because you have really a bad uncontrolled diabetes.
Right.
So if you're getting digits or toes cut off, then your diabetes is severe enough that you're going to get that 100% rating. How does a veteran with diabetes strengthen their claim in order to get service connected? What are some of the things that you have seen, working as a VSO in the past, that have been successful when a veteran's doing this?
Clear documentation. So you need the diagnosis,
Yep.
treatments, what type of treatments you're on. It needs that clear statements of what, so it shows which part of that category of your percentage that you need to, you're trying to get to.
So that's important for establishing the severity.
Right.
But what about getting service connected? What are they doing in their records, their medical records, to try to show that this is service connected to, say, I don't know, PTSD?
Showing the medications that they took. I was this type of weight at this time, and it brought me to this weight because many of the antidepressants, they, common side effect is weight gain.
Yeah, so if your argument is that I have a disease or a disorder that has led me to gain weight, which has caused my diabetes, you're going to need it needs to be clearly demonstrated in your medical records that you have this trend of weight gain and that it occurred, because of the disorder that you're claiming it to. So if it's PTSD, first of all, your PTSD has to, pre-exist the diabetes. And then it would be helpful to show that what your weight was prior to starting your antidepressants and then what it is today.
Right.
And then more beyond that, if you can get your medical provider to write in their notes that, yeah, his diabetes is likely from weight gain from his antidepressants.
Right.
Or, yeah, weight gain is a common side effect of antidepressants.
Right.
So, and that's where I get back to using that secure message chat feature of your EMR or your My Healthy Vet is, if your provider's not writing it down and you've had that conversation a couple times, be your own advocate. Send a secure chat message because that goes into the chart. And you can say, hey, doc, I have been on my sertraline, my antidepressant, for X amount of time. I noticed that since I started it, I have been gaining weight and it's been really hard to lose weight. Is that a common cause for weight gain? And then that goes into your chart. It gets timestamped. And then what else does it do? It prompts your provider to respond. And the common side effect of antidepressants is weight gain. And they're going to say, yeah, actually, that's one of the more common side effects. And now you've got your nexus. Indirectly, they've admitted that, yeah, this is causing weight gain.
Right.
So now you've got you have verifiably shown that this medication because of your PTSD, has caused weight gain. And it makes it that much easier for your argument to show that PTSD is causing your diabetes. It's just documentation. Just keep bugging them. Keep pinging them with these secure messages. Stuff it up with as much stuff about how long you've had it, why you think it's occurred, what can they do about it. And, they're going to respond to it. It's not just good for your documentation, but it's also good for your care and overall well-being, right? Because it's going to help prompt them to actually take care of you the way that you deserve to be taken care of. We've got medical documentation. What else can a veteran do to help strengthen their claim packet?
Buddy statements and lay statements.
Okay, so lay statements like a personal statement. Lay statements or witness statements.
Yes, these are going to be good because this is going to show how it affects your daily living.
Now, do you recommend that everyone does this or just some people?
I don't recommend it. So I will always and forever on every episode that we will go on from here on out, I will always say a personal statement and a buddy statement never hurts a claim.
What you're doing is you give that claim provider multiple different lenses to look at the same problem, right?
Right.
So from your point of view as the veteran, from your spouse's or buddy's point of view, from other medical providers, Nexus letter point of view, it's all looking at diabetes from different angles, and it puts together this whole picture.
There's another outside person that's involved. It's your family or your friends, and they go, he never goes out. He doesn't want to go out because his feet are killing him. He doesn't come out and do anything.
He doesn't work out. He doesn't inactive.
He
just eats all the time.
He's depressed. Along with the Nexus letter, you're throwing the sink at them.
So the key is with these witness statements and the personal statement is you don't just talk about how severe your symptoms are because you have the diagnosis. The key to these letters, personal statement and witness statement, is you need to talk about why the thing you're claiming your diabetes to has caused your diabetes. All right. So if you're arguing weight gain because of chronic pain because of your knees, then your witnesses and you have to talk about how your knees have progressed to the point where you can't really walk anymore. You're falling down. You've got a sedentary life. You never leave the house, and you've gained weight, and that's why you have diabetes. Let's talk Nexus letters. Anyone that comes to us is coming because they want a Nexus letter, but in your past life, when you're doing VSO stuff, when have you recommended that a veteran actually seek out a medical opinion or a Nexus letter from their provider or a provider?
Here are the top 3 herbs that naturally boost testosterone. Number 1, Yasada Basma. This is
So this one's going to be pretty simple. Not a presumptive condition and not direct service
So
connection.
nothing in they're silent for their service trooper records.
Silent. Diabetes is going to be a tough sell for a direct.
Yeah.
It's going to be a secondary.
And so most of the secondaries you're saying with diabetes, you're recommending they probably need a medical opinion.
We said that common denominator was obesity.
Yeah.
And the VA really loves that word.
A lot of guys that get denied and come to us, you read the denial letters and it says, you have been denied. We recognize that you have diabetes, but you've been denied because there's no nexus. We just think you're obese. So, all right, yeah, I am obese, but it's because of XYZ. So that's when you're going to need that letter to clearly explain in medical terms and pathophysiology why it has progressed that way. That is key. Yeah, I agree. I think a lot of these guys are going to need a letter. Ask your provider, come to us. We'll help you out. We've been very successful in getting this linked for other veterans. But that's the wrap of this episode. And I think the key points, the key takeaways is if it did not get documented in service or it's not a presumptive, you're going to have to really, really build a strong case, and you might as well start thinking now. You're probably going to need a next letter. So start asking your provider now, or come out, reach out to us, and we'll hook you up. Next time, we're going to actually be getting into another topic that I really am interested in. It's how witness statements can make an impact in your case, and we're actually going to be bringing in a spouse next week to be talking about how we can use our spouses and the ones we love to strengthen our cases. But until next time,